Department of Anaesthesia, Pain and Critical Care at Obstetric Hospital. It gives me immense pleasure to welcome you all to today's symposium on Updates in Anesthesia and Critical Care Management. We'll first commence with our first panel discussion, which is on medical legal issues of obstetric population in Pakistan. I would like to invite our esteemed chairs, Professor Suhail Lodi, Professor Khalid Rashid, and Professor Brigadier Muhammad Tariq on stage. I will request Professor Ashraf Zaki to kindly join the stage for the chairs. Thank you, sir. Moderating this comprehensive panel is our own Dr. Sana Siddiq, who is joined by our honorable panelists, Professor Rubina Suhail, Professor Ashraf Zia, Professor Brigadier Muhammad Ahsan. I request the panelists to kindly come on stage. I request Dr. Sana Siddiq to take over the podium.
Assalamu alaikum. I welcome all my respected panel, the chair members, Professor Dr. Khalid Rashid Saab, Professor Dr. Suhail Lodi, Sir Ashraf Zaki, and retired Professor Brigadier Tariq Saab for joining us on today's event and gracing the event, taking out time for us. Thank you, Lord. Thanks a lot, sir, on the behalf of entire Anaesthesia Department of Obstetric Hospital. And my respected panel members, Professor S.M. Saab, Madam Rubina Suhail, and Dr. Ashraf Zaki. Thanks a lot, sir, for joining us today on this panel discussion and gracing the event. The topic of today's panel discussion is medical legal aspects in OBS population in Pakistan. The medical legal issues in OBS population in Pakistan is an overriding issue that is affecting many of our colleagues, and once somebody is stuck into it, then it is a major chunk of emotional, financial, and psychological trauma. So today we have the honor of creating an expert panel that comprised of the most senior anesthesiologists and gynecologists from Lahore today with us, and they will share with us their expert opinion about what is the main cause of these medical legal litigations, and if someone gets into it, then how can they be prevented, and how can the incidence of these medical legal litigations could be reduced, and they can share their expert opinion for the junior colleagues to help them get out of this situation if somebody gets into it. But before going to the discussion, I would like to give a brief introduction of the panel. Sir Ashraf Zia is currently leading the Department of Anaesthesia Surgical ICU, Jinnah Hospital, Lahore, and he has been working there since more than 10 years, and he is the departmental head. Madam Rubina Suhail has a huge experience of the field. She has been working in the specialty of gynecology since more than 20 years, and she has worked in both the public and private sector hospitals in Lahore. Madam is a retired professor of gynecology from Surgical Institute of Medical Sciences. Brigadier Ahsan is currently leading the Department of Anaesthesia, CMH Medical College, Lahore, and he is uniformed brigadier and currently the team lead in the CMH Medical College, Lahore Operation Theatres. Then in our worthy chair members, the Brigadier Muhammad Tariq has served Pakistan Army for more than 30 years, and he has been awarded Star Imtiaz for his diligent services. Sir Khalid Rashid needs obviously no introduction. Fathers of the teachers of our teacher, most fatherly figure of anesthesia, and he is a pioneer of anesthesia and pain medicine in Pakistan. Sir, huge respect to you, and welcome once again on behalf of our department. We are extremely grateful for your for you to making the event. Then we have Professor Dr. Suhail Lodi, Sir is one of, I think, most senior gynecologists today with us. Sir is practicing gynecology since 1977, and Sir is pioneer of laparoscopic gynecology in Pakistan. He is the one to begin it, and Sir, I'm extremely thankful and extremely honored for your presence, and so thank you for gracing the event. Then we have Professor Dr. Sir, again, he is no introduction as the head of anesthesia department in All Associates, and he is also the lead in anesthesia and one of the pioneers of anesthesia in Lahore. And we have a huge respect for all of our panel members and chair members. Thank you all of you for coming. Then coming to the panel discussion, my first question would be to Madam Rosina Suhail. Madam, you have a huge experience in the field, and can you kindly tell us about the most common medical legal issues you have faced during your practice, and most commonly जो आपके obstetricians mostly come across them, or what could be done? आप क्या advice देंगे juniors को कि क्या practice को change करें ताकि इन चीजों से थोड़ा सा महफूज रहा जा सके?
Thank you very much. Thank you first, Professor Naseem, for inviting me over here. I think obstetric specialty is a very dynamic field.
Yes.
And the situation in obstetrics is continuously evolving. And it is associated with not only the life of one mother, but it is also associated with another life. So emotions are running high in the labor room, not only in terms of the patient herself, but also in terms of the family. So a little bit of misunderstanding or perceived lack of care can lead to big issues. The availability of the gynecologist at that point in time, the availability of the anesthesia staff in terms of epidural, these are all issues for the patient. So if you ask me what kind of cases we have had, I think that any number of times that we have gone to the Healthcare Commission for issues that the patient have perceived, the perceived issue has been negligence. And most of the times, if you go into the depth of the issue, it is not actually actual negligence, it is that perception of the patient that she was not taken care of properly. And I think that is where we have to really stand united, and we have to follow the principles of respectful paternity care, and also make sure that we are within our ethical framework of conduct. Only then we can protect ourselves from litigation and from other situations.
But there is a very slight line between negligence and the medical error. So medical error is obvious. We cannot protect ourselves all the time because it is inevitable. Sometimes we are into a situation where we do not know the outcome of the patient, but it could be. But the patient all the times don't understand it. और उसी एक line को I think जैसा मैडम कह रही है कि negligence और medical error को हमें separate किस तरह करना है और किस तरह से हमें patients को simplify करना है. So my next question to is Dr. Ashraf Zia. Sir, you have been practicing ops anesthesia in Pakistan. Pakistan is a state with extremely low literacy rates, and we are massive with no concept of individual rights. So sir, इसमें informed consent को थोड़ा सा explain करें कि patient आ जाती हैं, epidural लेना है, late stage of labor में, mother-in-law भी खड़ी है, husband खड़े हुए हैं कि नहीं जी हम तो consent नहीं दे रहे, female को चाहिए कि जी मुझे तो लेना है epidural. या एक और सिनेरियो बड़ा कॉमन है कि बीटीएल पेशेंट बाहर से कहकर आती है कि जी आई एम फाइन टू गो विद इट ऑन टेबल जी हस्बैंड से भी पूछ लें. तो सर इनफॉर्म्ड कंसेंट की क्या इसमें इंपॉर्टेंस है और किस तरह से हमें इसको टैकल करना है, बड़ी चैलेंजिंग सिचुएशन हो जाती है. और सर मेडिको लीगल लिटिगेशन को एडॉप्ट करेगा ये हमारा इनफॉर्म्ड कंसेंट का प्रोसेस और इसको किस तरह से लेके चल रहे हैं सर काइंडली थोड़ा सा बताइए.
So I would like to congratulate Department of Anaesthesia and Critical Care and pay my event Community Hospital for and thank you very much Professor Naseem for inviting me over this symposium. Actually this scenario is very important because most of the time when I have been called to PHC, Healthcare Commission, the problem with the majority of the scenarios is regarding consent. The question you have raised is very important in that aspect. Sometimes patient wants general anesthesia, attendants are willing for spinal anesthesia, they have their own concerns. Attendants are willing for general anesthesia and patient says no, I don't want to be anesthetized. because I heard that some people they are not reverse giving being general anesthesia. So the important aspect in this case is the counseling and pre-anesthesia assessment which I have encountered. If you sit with the family in pre-assessment area and counsel both attendants and patients and tell them pros and cons. Okay, what are the aspects or advantages of spinal anesthesia and what are advantages or disadvantages of general anesthesia, then it may be possible to get some consensus. But sometimes it's very difficult. Female wants that she will be should be anesthetized, but patient is having chest infection. You counsel the patient that general anesthesia may not be safe. Sometimes the problem is in the operation theatre. Attendants are outside the operation theatre and patient is inside the operation theatre. You have a problem over there. Patient wants, no, I am not willing for spinal anesthesia. But attendants outside, no, give spinal anesthesia. So in that case, it's very difficult to handle that situation. But one thing which is very important in every case is documentation. If you document each and everything, majority of your problems and your complications are overlooked. The question as Professor Vina was saying and who asked about negligence and complications and negligence and other question was medical error. So these are two different scenarios. Medical negligence is not defendable in healthcare commission. And if you have some problem which is medical error, or sometimes you are facing with the problem like which is documented in the books and you have common errors like that, that can be defended. So problem is over here. And if you are talking about the epidural, the female wants epidural, but attendants are not willing for epidural to other reason, maybe financial constraints or something else. The important aspect is to have a joint counseling of attendants and especially the mother-in-law and patient and husband. These three persons should definitely be taken on board because majority of the problems arise when there is a communication gap.
ठीक
So
है,
that's
thank
my
you so
point
much.
out.
Thank you so much, sir. Madam, for add-on करें